Welcome back, crackheads. Thanks for tuning in. Dr. Chris here. And today we have our pop star, Megan. Megan, how are you?
I'm good.
Good, good. Thanks for volunteering to shoot this video with us today. So first of all, what have you been coming in and getting treatment for?
Well, I was diagnosed with scoliosis.
You're diagnosed with scoliosis. And when were you diagnosed?
Mm, Last year?
Last year. And how old are you?
I'm 15.
Okay, so you were diagnosed when you were like 14.
Mhm.
Okay, perfect. So we know you have scoliosis, and what kind of symptoms do you have because of that?
Well, I don't really have too many symptoms. I just know that my back spine is like curved in a direction it probably shouldn't be curved in.
Sure.
So that's why I'm diagnosed with that.
That's right, that's right. And then do you know which direction your curve is?
Right?
Yeah, good. Yes, it is off to the right. Okay, perfect. So we'll talk a little bit more about what scoliosis is, how chiropractic can assist with that, and then just adjusting teenagers in general. Okay, so you ready?
Mhm.
All right, perfect, Megan. Let me have you lie face down for me. You know the drill. Okay, so we're going to give you a little massage here, loosen you up as usual. All right, so first of all, what is scoliosis? So, like Megan already said, scoliosis is a kind of sideways curvature of the spine. So if you look at the spine from the side, you actually want to see curves, which I'll show you on the spine in a second. But if you look at the spine from the back, you want it to be perfectly straight. Scoliosis is when you look at somebody's back and it actually is curved horizontally. You can either have one curve, which they call a C curve, or you can have a curve in your upper back and your lower back, which they would call an S curve. Now, obviously, scoliosis has the potential of causing a lot of pain because it's literally torquing your entire body at that point. And not only does it torque your spine, but a lot of the times it rotates your entire thoracic cavity because your spine's connected to your ribs. Now you want to make sure if you have any children, you want to make sure that they're getting checked for scoliosis at a very young age and every single year. Because at the age of 16, which Megan is approaching, the spine pretty much stays in the same place for the rest of its life. So if your child does have scoliosis, you want to find out as soon as possible and you want to start treatment as soon as possible to hopefully limit or decrease that curve as much as you can before they hit that age of 16. So that's why we've been treating Megan so regularly. Megan, we get you adjusted at least like twice a month, right? Every other week?
Yes.
Okay. And then also since she came in, she knew she had scoliosis. She didn't know the degree of her curve. So the first thing that we wanted to do was order an x-ray. And that's what I would recommend as well, because the screening for scoliosis, which they call it a screening because it's not necessarily a diagnostic test, is where they have you bend forward and then they look at your back to see if one side is elevated or not. So that's how they screen for scoliosis. But if you have a child that comes home and said they have scoliosis, you want to take them to a doctor and get an x-ray series to test for scoliosis specifically so you can see which direction the curve is, if they have a C or S curve, and you want to know how many degrees it is. Okay, because if it's just mild, you might be able to get away with just chiropractic therapy. If it's moderate, it may require a brace. And if it's severe enough, some patients actually do require surgery where they have to actually go in, and it's a very invasive surgery where they have to put in a lot of rods to keep the spine in alignment. I have a couple of patients that we actually treat who've had that surgery. So bottom line, get your kids checked for scoliosis as young as possible and as often as possible. And then real quick, before we start getting into the cracks, I do just want to show the spine real quick to show what scoliosis looks like. So I would consider scoliosis a major misalignment. All right, so it's pretty much when the entire spine is curved off to the side. And this is probably the most common presentation of scoliosis. It's in the thoracic spine and it's curved off to the right. That's the most common. All right. It can curve off to the left. And if that happens, that is a very serious condition because your organ on the left, your heart, starts to get compressed, and that can actually cause a lot of cardiac issues. All right. So if you have that left scoliosis, that's a big problem. So Megan's here is off to the right. It's about 19 degrees. And right now we are trying to kind of decrease that. All right. But let's say Megan in 5 years, she's going to be 20. Let's say she still has that scoliosis. Even though she's 20, that doesn't mean she should just give up and stop getting adjusted. The adjustments can still help alleviate some of the symptoms that are related to scoliosis. So if you have scoliosis and you're like, oh, well, shoot, I'm 30, I missed the boat, not true. So even though this major misalignment may not be able to get fixed, you're going to have minor misalignments at every single level because of that curvature. So what I can still do is I can still correct these minor misalignments throughout that major misalignment. All right, so you still, even if you have scoliosis, especially if you have scoliosis, you want to see a chiropractor to alleviate these minor misalignments, and that'll help alleviate a lot of the symptoms that you're having. All right, so with all that being said, let's see what's going on. Megan, if you have any pain, just let me know, okay?
Okay.
All right, so that's good that you're not having any symptoms because of your scoliosis. And also, okay, hang on 1 second, just feeling. Yep, so the scoliosis is like right through here. You can feel the little curvature to the right. All right, so what we want to do is we want to try to bring this whole segment back over to the left. Okay, so we're going to pull this curve over to the left, set it back down. I want you to take a big breath in. Good, and let all the air out. Perfect. Good, how'd that feel?
Good.
Okay. Also for Megan, just as a developing teenager, adjustments are beneficial because you want to maintain the alignment of the spine so that you develop where you're supposed to. All right. Even without this scoliosis, I recommend that all children get adjusted as well. Maybe not every other week, but at least once a month, just like an adult would. Okay, we're going to get this CT junction here. Little off to the right at like T1. So head's going to come to the side. Good, just relax. Wow, that was a good one. Okay, good, another side. Same thing, a little higher, nice and easy. Good, okay, you can look straight down. Perfect. So what grade are you in, Megan?
10th grade.
Oh, nice. And what's your favorite subject?
Spelling.
Spelling. Interesting. How do you spell platypus? Put you on the spot.
Platypus.
Sounds right to me. All right, good job. Okay, so your lumbar spine's a little off. Ooh. A little curvy through here too. So a little off to the right at like L1. All right, and then off to the left, kind of compensating for that thoracic curvature. Lower, L4 and L5. Okay, and then now we're going to check your pelvis. So I want you to keep your right leg straight. Raise it as high as you can for me. Good, you can let it down on the other side. Good. Okay, was one side harder or more painful?
They weren't painful, but I think this side was a little bit harder.
Okay, so let me have you cross your right foot over your left foot, please. Okay, good. Okay, so your tailbone is rotated clockwise. All right, we're gonna spin that back into place. We're gonna use the drop here. Nice and easy. Good. Good. Last one. All right, good. You can uncross for me. Okay, check your leg lengths. All right, so right leg's a little shorter than the left leg. Okay, so again, what that means is that your hips, instead of being like this, are like this. We're gonna put them back. Let me have you turn on your side, face towards me, please. Okay, good. Arms here, good. This knee up. Good, nice and easy, all right? There you go, that was a really good one. Good, other side for me. Okay, perfect. Same thing. Good. Okay, you can lie on your back for me. Perfect. Okay, let's check those leg lengths here. All right, good job. Okay, let's check your neck, okay? You're doing great. All right. You ever have any neck pain, any headaches?
I get headaches, but they're like regular, just like not from any issues with my neck or anything.
Okay. And where do you get the headaches at? Are they in the front of your head, the back of your head?
I think it's like, I don't know. I think it really depends. Sometimes it's just because like I spend too much time on electronics.
Yeah.
Like if I'm doing like online schooling or whatever.
That'll do it.
Or if I'm just like there's too much noise or something.
Mm-hmm.
I don't think it's like anything with my neck or back or anything.
Your alignment.
Because I get adjusted often enough.
Right. So maybe just too much electronic time.
Mhm.
Okay. You drink plenty of water.
Yep.
Well, that's good. Okay. Good. Just relax. Let's check the neck here. Nice and easy. Nice. Good job. Moving great. Last one, Megan. If you have any pain, let me know. A little tight there. Nice and easy, just relax. Good. All right, perfect. All right, Megan, good job. We got everything back into place. All right, we got some really good adjustments through your thoracic spine, right where that curvature is. All right, good job. Let me help you up. Come on up. There you go. Perfect. All right, great job. So thanks again for volunteering, being our pop star today. How do you feel after your adjustment?
Good as usual.
Good as usual. That's what we like to hear. Perfect. Thank you so much. You're the best. All right. Thank you guys for watching. Hopefully you guys learned something about chiropractic and scoliosis today. We appreciate you tuning in. Make sure you subscribe to the channel, like the video, and tune back in for some more awesome Cracky Crack videos. Thanks a lot, and remember, I got your back.